I just advise everybody that this, pardon me?
Mr. Chair, March 3rd, 2022, Tri-Town Boards of Health. The meeting is being recorded in accordance with the open meeting law, and the recording will be available on CTSB after it's uploaded. Go ahead, Mr. Chair.
All right, thank you, Jim. First of all, the first order of business is to approve the 1:26:22 minutes. Do I have a motion to do that?
So move.
A second?
Second it.
Any discussion? I'd like to point out that there are a couple of typos in the minutes. I don't think they changed the clarity of what we're talking about or anything like that, except there's the very last one. I don't know, Zach, did you do this or whatever? Where it says, now my grandfather was from Brooklyn, and he might have asked for a motion to adjourn, but I asked for a motion to adjourn. So if we could change that so my grandfather understands things a little differently there. Otherwise, we have a motion to approve the minutes? I mean, can we have a vote to approve the minutes, please?
Aye.
All in favor? Yes, okay. Okay, next order of business is the open meeting law complaint. Jim, do you want to fill us in on that?
Sure. We did receive a open meeting law complaint on February 20th, 2022. And I'm just going to ask that someone make a motion to refer it to town council to assist us on that response.
So move.
Okay, just to get the board members on board about that, Jim and I did discuss this with town council, and that was the recommendation. So I'll ask for a motion to follow Jim's recommendation there.
So move.
Been moved. Yeah.
Second,
I'll second it.
all in favor?
Aye.
Opposed? Okay, next order of business is the current masking directive. Jim, do you want to give us a report on the current status of
Sure.
the epidemic at this point?
I'm going to do a couple screen shares, Mr. Chair. First, I'm going to show this about a week ago. Our public health nurse team sent out the COVID positive updates, and we've been tracking this for a while. If you look at February 20th through 26th, you can see that the numbers are tailing off on a continued pace, which is good news for everybody. Stop there, and I'll just show you the most recent dashboard that Amy puts out every week. This is representative for South County as part of our Southern Berkshire Public Health Collaborative. And you'll see way to the left where the numbers were at its peak for Delta, where we hit our highest peak of local Omicron on January 8th, and has since continues to go down. So the trends are going in the right direction, folks. And, and I think, getting to the mask directive, and, DESE announced a few weeks ago that they're giving the schools authority to lift masking in the schools on February 28th, but gave the school committees authority to decide when, if and when, how they want to do that. And then shortly thereafter, the CDC, working through DPH, actually put out a notice that the kids didn't have to wear masks on buses any longer. Again, the schools are still deciding on that. Last couple Fridays ago, the CDC updated their masking guidance to confirm with what DPH has put out, and several boards of health across the state have rescinded their mask mandates, mask directives, mask advisories. And DPH and CDC did put out a most recent guidance document the other day, which we'll put on our website. And basically what they say is the CDC now recommends that masks are still required in certain settings. For example, some transportation and healthcare facilities, but then they really recommended that masking should, for those that aren't fully vaccinated, masking should be adhered to, but it's not a requirement. And those people that have conditions that are at high risk, or a family member that's at high risk. And there's a link on the CDC website. But again, folks should consult their physician to determine if people are considered at risk for COVID. And I think with with all the information that we have today, I'm going to ask the board if there's a motion on the table to rescind the mask directive that was put in place in September and really just follow what the DPH and CDC guidance is. And just for those that are concerned, they should try to mask when they can, but I think the directive has served its purpose, Mr. Chair, and I really feel like that masking directive, although it was never a mandate, it actually saved lives. And I really want to tip my hat off to the Tri-Town community, because when we did put this masking directive in place back in September, when we were really getting hammered on Delta, the majority of the community really stepped up, knowing it wasn't a mandate, and did the right thing. But I think our mask directive has served its purpose, Mr. Chair, and I'll open it up to any questions. And
We have one hand raised, Gene Pollock.
yeah, Zach, we're going to move to citizen speak time. And I think what I'll do is announce as well, there's a whole public comment section further down the road, because the masking directive is not a public hearing per se. It's just really, it's an action that the Board of Health may take, and then the chair can open it up later down the road.
Perfect.
Okay, well, does the members of the board have any questions about what Jim just presented? Okay, Jim, let me just, can I just ask you to do a couple of things? I'm going to suggest it just because I've heard from people in the community about this, and I think some of these ideas were good ones. One is that as straightforward as the DPH guidance may seem to be to some of us, I think that it would be very useful for businesses in particular who have had taken a very significant amount of the responsibility of educating the public through the signage that they put out. It might be very useful for these businesses for us to put on our website a printable signage statement that just makes it simple for them to just put up what the new thing is. Is Zach responding to what I'm just saying now?
I am. I got it made this morning.
Okay, so, all right, so now mass preferred is an idea. I don't know that that does what I'm really asking here. I think that I really do think that the businesses are smart enough about this and educated enough about this to be able to understand that they want to do the best thing. And so I'm wondering if the board might not want to have, and this is my suggestion is that a more specific recommendations that, or at least to enumerate what the DPH is saying and simply. So in other words, the DPH is saying masks are no longer required for vaccinated people. I think that could be a header right up at the top. I think that makes it very clear that there's no, and a second suggestion I would make is that the DPH still recommends, is that what the statement would be, Jim?
Yep.
That unvaccinated people wear masks in public places. Now, those two statements I think are very clear statements. Does anybody on the board have anything more better to say? I see Vax point there, but I'd like to be more specific. You know, people have taken this very seriously, and I understand we want to get into a point of levity, believe me about it, but I do think that we need to follow up the earnestness that the community has showed in this by being earnest in terms of what we tell them to do now. And we're basically not telling them to do anything except follow the DPH guidelines, but I think we should state what they are, at least very simply like that. So I would say that we have something like masks are no longer required for vaccinated people in public places, except for the person's own protection, if you want to put that, but I don't think we need to do that. And that masks are recommended, or if we want to say required, by the DPH for people who aren't vaccinated.
Yeah, I would like to, Mr. Chair, I would like to stay away from any language with required.
Yeah.
I think it sends mixed signals. Even with the mask directive, there's a lot of mixed signals there. I mean, Zach and I can put our heads together, come up with signs if stores would want to put them up. And I'm not suggesting, if we get the motion to rescind the directive that masks aren't required to be put up, but available as a resource for those that want to put them up.
Yeah, I think it's going to be very important that we make it very clear that masks are not required and that they're not even recommended by the DPH at this point. That would be my feeling about it. Okay, well, Jim has asked us to make. Do we have anybody else have any questions or anything else to add about that? Can I have a motion about Jim's recommendations?
So move.
So, John, would you say that you'd like to move that we follow Jim's recommendations as he just stated them?
Yes, to rescind the directive.
Okay, and did we have a second on that?
I'll second that.
Okay,
It's okay.
any discussion? Okay, all in favor?
Aye.
Aye.
Anybody opposed? Okay, it's a unanimous that the directive that we put out earlier has been rescinded, and I think we should all be happy. That's very good. Now, this is at a very important stage. A couple of people that I spoke to a lot of community members about this prior to this meeting, and I think one of the feelings that some people had is that we've already been through this. For example, we've had two separate peaks before this. Last year, we had a peak in January, and eventually was followed by the masks weren't required anymore. And same thing originally, but I think we've got a different situation now. I'm hoping that I don't have to knock on wood about this, but I do think that, we've got a very significant difference in terms of the germ now. We do have to look, keep a lookout, but we have over 75% of people in the state are vaccinated. And we had a huge number of people actually infected by the Omicron and become immune as a result of that. So we're going into this next phase. I think we can be a lot more sure that we've beaten this disease back, and we may need to get a new set of vaccines eventually, but it's going to turn out to be eventually like the flu, and that's what I'm hoping. So I hope we can give people a positive note about this, and I hope the boards keep in mind the fact that not dealing with the germ, being able to sort of relax about the germ is only part of what we need to keep doing. And one of the things, the other part of it is that people suffered from this, and all different groups of people suffered. The seniors, the kids, mental health issues developed, stress issues, and all sorts of other things. And the communities are going to be seeing this going forward. And I'm hoping that we can serve as a coordinator for helping people to move through that aspect of what happened. And I hope that the boards keep an eye out for any kinds of suggestions or anything, so that Tri-Town can be advised about anything we can do to try to help in that respect, if you see that developing in your communities. So on that note, do we have anything else that anybody on the boards would like to say? We don't have anything else on the agenda right now before the citizens speak. Can I open it up for citizen discussion and questions?
Yes, Mr. Chair, and Zach and I will manage the people that have raised their hand. And the first person that raised their hand was Jean. And Jean, I'll ask you to unmute.
Done.
Go ahead.
Are we ready?
You're ready.
Yes.
Okay. Hi, everybody. I'm Jean Pollock, and I live in South County, but I work in Stockbridge. I have a lot of friends in the area, and that is like the central area of the South Berkshire. So it's an important area to be holding the reins of what people wear when they go places and so forth. I'd like to address, first of all, the issue that no one seems to mention, and that is that the CDC says that there is a 99% recovery rate across the board for COVID. And I would love to see the fear dialed back a little bit, and doctors do their doctor thing, like saying, get outside, get fresh air, get vitamin D. Fear weakens the immune system. So that being said, I wanted to address the masking thing. Jim said that masking worked, but because he put in some sort of a masking thing in September, but right after that, he said that cases spiked after the masking began. So I don't know how he connected masking working with cases spiking. I've done a lot of reading about this for the past couple of years. I'm not just going to believe what comes across the fear mongering, which I'm not going to be part of. I'm going to deal with things on a practical level. I have found no studies ever that have been done that show that masking helps anything. On the other hand, masking, and when you wear a mask, you're touching it, adjusting it. So you're always loading it up with whatever bacteria you've got on your hands, and then you're breathing out and out of your nose and mouth. It's getting damp, it's holding bacteria. No wonder cases spiked when you started wearing masks. They're filthy. They capture microbes, and your oxygen is depleted, and you're breathing in carbon dioxide. So I would really like to have those thoughts considered. I mean, I've got pages of studies showing that masking doesn't work, and that they were done long before we had this epidemic. So I'm very happy that you got rid of this masking degree, and that's all I have to say. Well, I could say a lot more, but I'll let you go.
Thank you.
You're welcome.
Redbird was next.
Hi there, I'm Cardinal Montano. I live in West Stockbridge, but I often work in Lee and Lenox and Stockbridge as well. So just a couple of things. How many of you are aware that the CDC, Fauci, and Gates have all stated publicly over the last couple of months that the vaccinations do not block transmission or prevent disease? Are you aware of that? It's confusing because the messages are confusing. We're getting mixed messages all across the board. But in the end, 2 + 2 = 4. It will never equal 5. If they're going to say one thing and they're going to mandate another or recommend another, it doesn't matter. They've said all publicly that the vaccines are not working. And here and there over the last couple of years, they've also said that the masks do work, and then they've said they don't. So what I really want right now is for this this unfounded discrimination to end somewhere. That vaccinated people should not need to wear masks and unvaccinated should. There are absolutely no grounds to that, zero. There's no science to it. There's no reason to it. And we need to stop doing that because it's dividing the communities, all of us, all across the board. The other thing I'd like to say is that I don't know, are you aware that the FDA recently released on March 1st, the first 100 pages of safety data, the Pfizer safety data. Initially, they had been, I know that this is causing some eyes to raise, I think I'm seeing that. Either way, it has happened. They first wanted 55 years and then they asked for 75 years to release the data. They were forced to release the data through FOIA request, thank goodness. I'm happy to send you the link to the first data that has come out. There's a bit over 100 pages of this. And if you go to page 30, that's where the section begins on the side effects, and it's lengthy and it's shocking. And it's pretty damning. So given that, as you think about informing the public about masking and this, that, and the other thing, it might be also good to let the public know that this information is now available because it has not previously been available, which is quite damning, actually. I I don't know how anybody was able to give informed consent or anything like this, but here we are still tossing the policies about masking in stores or restaurants or whatever it is back and forth, whether vaccinated or non-vaccinated people should wear them. The bottom line is what we need to be focusing on is what the health repercussions are going to be on those who actually did get these vaccines before the safety data was released. That's pretty much all I have to say. I mean, we can go back and forth about what we want to tell people and what we want to put on store windows. But the bottom line is there's a lot of very, very important stuff that affects people's health that's coming out now. And the discrimination has to end. Thank you for your work.
Yeah, I'd just like to say something about that. I think that it's very important to understand that there is a lot of conflicting information about this disease, and it's been out. And I appreciate that when people step forward at the public speak, that you can assert one side of the picture. But I would say to you that at least I know very particularly that several members of this board have reviewed almost all the information we can get about this. And it is, I agree, conflicting. And in medicine in general, just as an orthopedic surgeon, as a doctor for 50 years, there's very frequently conflicting information about the way things are going. What we have done has never, ever intended to be discriminating in a way that's negative against anybody, particularly for their points of view about anything, but it was just done based on the information that we had available, the sum total of the information, not just a single thread of information, the sum total of information that we had available, and the fact that we do look at and respect the DPH and the CDC, and we try to follow their guidance as much as possible. And what we've said today about masking recommendations for people that are not vaccinated is the current CDC and DPH recommendations. And it's not, and I emphasize this, and I hope you understand this is not some conspiracy to discriminate against people. And I don't think that kind of an idea, even if you have the right to say that, makes it true. And even if you feel that that's the case, it isn't true. We're not doing anything to discriminate against people for being vaccinated. And personally, I think people have a lot of legitimate reasons for not vaccinating. I think there are a lot of reasons that masks don't work as well as we'd like. But the data shows, coming from our sources, our superior sources, that we should follow certain guidelines, and that's what we've done. And I think that this board deserves the respect that we made our decisions in the interest of public health and not to discriminate or to do anything negative in that way to anybody.
Mr. Chair, I had Katie O'Neill up next, if we can find her in the queue here.
Hi, everyone. I'm the director of the Lytics Library. Thank you for all of your work and all your guidance as we've gone through the pandemic for the past 2 years. I'm just hoping that you might provide some guidance. As Dr. Kenny has referred to, different agencies have offered different pieces of information particularly for unvaccinated. As a library, we serve a lot of children that cannot be vaccinated. So in going forward, I would just, to the extent that you are able, to provide clear guidance as to best practices for that cohort and their families.
Katie, I'll connect with you and our nurse team and we can have an offline conversation.
Great, thank you very much.
Mr. Chair, there's no more hands up.
Okay, well, thank you all very much. Can I have a motion to adjourn?
Oh,
Sorry.
go
Can
ahead,
I
Diane.
just, were we going to discuss anything else about mental health today? No.
Well, I think that if you'd like to bring that up as part of the citizen speak, I think that's certainly a topic that is germane.
Okay, I know that you and I spoke a couple of times about thinking about moving forward with what ways we might be able to help the people within our 3 towns maybe deal with it if they'd been stigmatized or in some way affected and needed a little guidance. And I didn't know, I know I invited a couple of different people that hold positions in Lennox to maybe enter the discussion to see if there's something they might like us to do or offer to them.
Well, I think that's a great idea, Diane. Does anybody have anything to say about that from the public?
Just raise your hand and we'll call on you if anyone wants to speak.
I also have something to add on top of Diane's. In my side of the world, the early childhood, which is going to show huge deficits in these young children, as the librarian said, she works with very young children. With all the masking that's been done, is there ever any thought of having any extra programs for the little ones who are now year and 2 years behind in their development, which is a whole public health problem in itself, that we're looking at the mental health, yes, of the adults and people, but the littlest ones who are going to have such deficits in the upcoming years from being masked, from being isolated from other children in centers and all those things. I worry about the next generation of children in the next 5 years going up into school age, because I'm not sure that we've thought about that end of it either as a health department.
Well, Joanne, how would you see the board interfacing with the community in that way?
Just think that maybe we need to think about any programs that are out there that we could, like Katie O'Neill from the library. I know my granddaughter goes to her library program, and I'm sure that, you know, programs that are already established. I know South County has some that I'm just very worried about the young children who are developmentally behind at this point, because it's going to grow in the next few years where they've missed daycare, they've missed school, they've been isolated. I heard a report the other day that having a 1 to 3 month lag in your education is a big gap, but now we're seeing children with a 1 year to 2 years gap is huge. And that is a huge issue. And then you're going to get into the mental health of the children who are so far behind. I don't know. I just, I think about that because I'm at that end. I don't know how it could be helped if there's programs out there through the Department of Health, or I'm not really sure. I'm just suggesting. I don't know.
Joanne, a couple of thoughts on that. We're working part of our Southern Berkshire Collaborative, which is a consortium of our 10 Southern Berkshire towns. We've been meeting with some of those schools, and they announced they've been getting some mental health grants. Not sure how that interfaces with public health and our nursing program, but our entire nurse program and health department, we've already been talking offline that we need to start to look at this. And, as far as going into the schools, we used to always go into the schools on tobacco education and vaping, and DESE and the school systems kind of pulled the reins back on that. But any funding opportunity or any other interface opportunities that may come up, we're definitely open to having those conversations with the schools, because you're right. I have 2 children in the school system as well that we're seeing signs of long-term remote learning and kind of that stuff. So I kind of take that stuff really personally. And I think that the boards, we're all starting to figure out how we can pull multiple organizations together to kind of move along on this, because that's the next phase as we come out of the pandemic, is what were the ramifications that this pandemic caused with multiple sectors, those in isolation, young people, and everyone in between.
Thanks. That's good. It's like the recovery now part needs to happen.
Yeah.
Do we have anybody from the school systems in the audience that might want to say something? Joanne, what do you think we ought to do to follow up on this? Do you want to?
I would love to have some grandiose idea that we could do. I just know that because I teach kindergarten, that we're seeing even this year that kids are coming in, that we've had a quote unquote sort of normal year. We haven't got rid of masks yet, but at least the children were present. Like last year, they weren't for the whole year, and the year before was the shutdown. there's children coming in with absolutely zero skills, zero. Like they don't know colors, they don't know things that preschools normally teach. If they didn't have that experience, they're starting so far behind. And then it does get into their mental health. They start noticing that they can't do what other kids do. It's like a snowball effect. I wish I had a magic bullet to know. I just feel like there should be huge summer programs or, things to help these kids catch up for the deficits. That's what I don't know. I don't know what monies are out there or what programs, but I just feel like it's a school issue, but it's also a health issue because it's going to be their mental health in the next 6 or 8 years, because they're going to be behind for a long time.
Well, Great Barrington is I know Great Barrington has a mental health for children program that's just come to the surface. And I think that some of the people in their school systems are looking at this idea too. I wonder if it might be worthwhile to communicate with them and see if they have anything to give us, and maybe invite them to a future meeting about this. What do you think?
Yeah, I think that would be good. I mean, we're now getting comfort dogs in our schools. I mean, that's where we're at, that we're adding comfort dogs for children who are so stressed. And so, that it is a huge problem. And I think it would be good to, look at that, because this is going to be the next generation that's coming up. And we really need to look at their recovery, that I think is parts of children are in crisis, and we have to help them figure it out. In our 3 towns, I don't know that there's any, other than school adjustment counselors, I don't know that there's any programs out there for the children. I know Lennox just got a comfort dog. I don't know what programs there are. I would be interested in knowing what was out there or how we could help the children of our communities.
And I'll follow up, Joanne, with Dr. Gosselin and Dr. Richard and Lee and Lennox.
Yeah.
Mr. Chair, Katie had her hand up, and then Darlene.
I'm sorry, I didn't hear that.
Katie O'Neill has her hand up again, and then Darlene.
Go ahead.
Thanks, everyone. Joanne, thank you for those comments. This has been something that I've really have personal and professional investment in. My son is in 7th grade in Lennox schools, and I can tell you that the kids are having a really hard time. So I recently attended a workshop that Austin Rec Center helped coordinate with the Southern Berkshire Community Health Coalition, and they talked about this collaborative care team that is taking the administration and teachers at Berkshire Hills School District, combining them with providers from Berkshire Health Systems and Mackinac to really address this holistically. I'm a big believer in it takes a village, and I'm a part of that village, and I've reached out to the schools. My youth librarian and I have been trying to develop programs to address a lot of these things that Joanne brought up. We serve the young ones, we serve the teens who have really been struggling with their own developmental issues around COVID. So I would love to be a part of those conversations. And I would love to see something like this Southern Berkshire Collaborative Care Team take hold maybe a little bit north of the most south part of our county, because it just seems like something that is so needed everywhere. And I know there would be a lot of support just from conversations I've had with parents, both of my son's friends here in the library, kids themselves who we try to provide a safe space for them. And I just think to all of your points that the more people we can get, the more organizations. I'm sure Darlene's going to chime in because I've been talking to her at the community center a lot about this. Anything that we can do to support what is a major health concern for our community. Thank you.
Darlene.
Hi, this is Darlene from the community center. So I just had 2 things. One, I did want to comment on Diane's. Happy to talk about any programs, Diane, that will help talk about the effects that COVID has played on everybody. The second one, I think somebody asked about preschool programs. We do at the community center too, a little bit different than what Katie does. South Berkshire Kids comes here and actually does a play group. And it was, they run the program here, and they actually added a second one. So, and I'm having conversations with them about other programs for kids that maybe the library wouldn't have because maybe a little bit louder. So those are, we're also talking to the high school about programs for the high school kids to come to the community center afterwards too. And we do have a great group of kids that come here after school every day.
Okay, would anybody else like to say anything about that?
Mr. Chairman,
Yeah, go ahead, Diane.
do you think we should try to have just among all of us on the Board of Health, a subcommittee to kind of look into what's going on and just kind of gather the information to see what's out there? If we're all isolated in our towns and don't know what everybody else is doing, do you think a subcommittee would be of any help? Jim? I don't know. I'm just asking.
Yeah, definitely. And I will say that the nurse team, part of our collaborative we already have this on our agenda item.
Okay.
And we're going to bring it to our meeting next Friday. But, there's a lot going on in these towns, but we should definitely, I think what we should do is, put that on as an actionable agenda item at the next meeting.
Okay.
To establish a group. I don't suggest that we do it during citizen speak time, but we duly noted we need to make that a priority for next meeting.
Okay.
Yeah, I like that idea, Diane. And I think if we had at least one person from each town, it would help to bring some sort of coordination, of the three towns. And I think
Yeah.
that I'm very much interested in trying to get the three towns to work together on this, because I think it's the antithesis of what's been going on during this epidemic. During the epidemic, we've been sort of trained to shun each other, to stand back from each other, to do all sorts of things in isolation and individually. And it's the antithesis of the sense of community. But I think everybody in our boards recognizes the very special perspective we have on the boards of health when we come together, the three boards, and we see how the other towns are doing stuff. And it's such a refreshing new perspective to see how each town does things slightly differently, or maybe considerably differently. And I think that if we had a way to help coordinate the towns to do things, it's not, of course, the kids are very important, but the seniors have suffered, the businesses have suffered, everybody's suffered from this in different ways. And it would be nice to try to for the boards, I think, to help coordinate in their towns this final aspect of dealing with the disease. I hope the final aspect, and that we can move forward. So I very much like your suggestion for a subcommittee, Diane.
Mr. Chair, there's no other hands raised. We're still on the citizen speak time, and I guess we'll just ask people if anyone else has anything else to add. If not, you can make a motion to adjourn.
Okay, well, I'd like to thank everybody for coming, and we will put that on the agenda at the next meeting as coordinated, how to look at a subcommittee to help coordinate the response to this disease as we move from the germ phase into the mental health phase. And thank you all for your input, the audience especially. And I'd like to have a motion to adjourn.
So move.
Second.
I'll second.
Okay, thank you. Everybody in favor?
Aye.
Okay,
you.
have a good day, everybody.
Thank you.